Okay, thank you very much, everyone, for joining us. Today, we are talking to Dr. Victor Hulme. Am I pronouncing your surname correctly?
Yeah, Hume. We say Hume, but
Hulme,
whatever.
Hulme. Okay, and he is from Aevitas Fertility Clinic. He's a fertility specialist there. So today we are talking about what you need to know about freezing your eggs. And I think in this day and age, because women are starting their families a bit later, it's very important to know this. It's very important to know what we need to do or why it's important to consider freezing your eggs. So I've got a few questions that I'm going to ask Dr. Hulme, but before we get into that, thank you very much for taking time out to speak to our ladies. Ladies, if you have any questions, please put it in the comment section. At the end of the talk, I'll also give doctor's email address, so you can contact him directly, or you can also get hold of him at Aevitas Fertility Clinic. They have a full page on our website, and you can contact them there, as well as through Instagram, Facebook, and all the other social media channels. Thank you very much, Doctor, and we're looking forward to having this talk with you.
Oh, you're welcome, Leanne, and I agree with you. The point that you made is, why are we talking about egg freezing? And that's really, women are postponing their first pregnancy all over the Western world. And, you know, in the UK, the average age of first pregnancy is now over 30. Oh. And, you know, woman is at her most fertile when she's 16 or 20 years old. So that is really why fertility preservation or egg freezing is, for us, a really important topic, and we want to raise awareness that women should at least know about it and make a decision.
Perfect. So I'm going to get right into the questions. I like what you said as egg preservation. I like that word actually much better than actually freezing the eggs. So that's what we're doing. So we're preserving our fertility for later on when we're ready. Perfect.
Yes.
So our first question is, what is the first step to check my fertility levels?
I think your general health and then also your age is really one of the most important factors that determine our success. So I think if you want to know a little bit more about your fertility, is to go and see a fertility specialist, or at least talk to a medical professional about your health and about the effect of age. When we talk about age, you know, when we do fertility treatment, we see a significant drop in success rates if women are older than 36, and especially if they're older than 38. So age is a major determining factor in our success.
Okay. Yeah. So why would women consider freezing their eggs?
You know, in the past, I think the main message is a woman can become her own egg donor. So our egg donors are all younger than 30. And even if you're up to the age of 35, and some women even older, if you freeze your eggs, your success rate is determined by the age that you were when you froze those eggs. Okay. So that's it. If you freeze your eggs when you are 34 and you use them that when you are 44, the success rate will be that of a 34-year-old woman.
Wow.
You become your own.
Sorry?
So you become your own egg donor. You don't, your young eggs to your older self.
That's actually a very nice one. That's great. At what age is, I think you almost answered that, but at what age is best to freeze your eggs?
Yeah, we usually say if you are under 35 and you cannot see yourself conceiving within the next few years, one should really consider that. Saying that, we have had women, I remember a case of a woman who was 40 when she lost a relationship, and she came to us and she froze 12 eggs. And she came back when she was 45, she had a new relationship and she wanted to use those eggs. And she had a twin pregnancy from those eggs. Wow. It is unusual to be so successful. But if she, you know, when you're 40, usually you won't get, the success rate is much lower. But she's an example somebody, if we told her you're too old, it would have been the retrospect, it would have been the wrong advice because she had a twin pregnancy from those frozen eggs.
Wow. Okay, so I'm actually seeing how important this really is about freezing eggs, because another doctor spoke about saying that, you know, every month you're losing eggs, and it's almost, it's, you know, at the end when you get to 40, it's only a few that you have over, and all your best eggs are actually when you are younger, you're losing them. So why not just freeze them?
Yes, and you know, and when you are 40, do you know how old your eggs are if you are 40? Those eggs are 40 years old. So you were born with them. Men make new sperm, but women are born with a number of eggs. We believe it's about 2 million eggs. And that's why women can freeze eggs or donate eggs even without limiting their own fertility potential. So it does not bring on your menopause if you freeze some eggs. Those are eggs you would have lost in any case.
Yeah, and just to mention that I know that Aevitas also does look for egg donors, and I know you guys have a sperm bank as well and egg donors. So if you are considering actually donating eggs, you can also contact Aevitas for that. Just thought I'd just throw that in there. Okay, let me just see. Benefits. What is the benefits of freezing at Aevitas?
And I just want to say one more thing. I'll answer that now. You know, initially when women froze eggs, there was a little bit of shame. Women told us they feel a little bit as if they have failed, that they don't have a partner, they're not ready for pregnancy yet. And we have a campaign at the moment where we say, we use the word boss. So be your own boss. Decide about, take power and decide about your potential. Now, at Aevitas, we have a stable team of embryologists. So our scientists have been with us for many years. Our laboratory is FDA certified for egg freezing. So that's important because it's not only the freezing, it's also the thawing. So we have done everything we can to give a quality service. And we're the oldest clinic, the oldest IVF clinic in South Africa.
Wow,
and in
okay. I actually had no idea. How long can you freeze your eggs for?
Probably indefinitely. So there's no data that says that there's expiry date. So definitely.
Okay, so and the quality of the eggs won't be determined by, you know, how long you froze it.
Not that we're aware of, no.
Okay. What is the process of egg freezing? Maybe you can just take us through that steps.
Yes, so the main thing is there's a hormone called FSH involved. Now, FSH is a hormone, I must just see if I can find that. FSH is a hormone, follicle stimulating hormone.
Yeah.
So naturally, women will make just enough follicle stimulating hormone in a month for one egg to mature. A human egg is the size of a full stop. So you can barely see it with the naked eye. So we can freeze one egg at a time, but you can imagine the more eggs we freeze, and we can talk about that, the higher the success rate. So we teach women to inject themselves with, this is the kind of product that we use. It's the same syringe that diabetics use every day. It's pre-filled there with FSH. And the woman starts on the third day of the cycle. It comes with a little needle. We teach her to inject herself in the abdominal wall. And then she sees us on day 8 of her cycle for the first scan to see if the treatment is working. We usually harvest the eggs on day 14 or day 15 of her cycle. And that's a procedure that we book the theater for 30 minutes. In fact, the aspiration under sedation, so it's painless. It lasts about 10 minutes.
Okay.
And over. So we try to limit the woman's time off from work. So there's one day that she cannot work when she gets sedated by a qualified anesthetist. And the other days, there are 2 more visits and then it's done.
Okay.
We aim to freeze. If we talk about the number of eggs, the ideal is 15 to 20 eggs.
10 to 20
with
eggs, okay.
Up to 80%. It's also sort of a rule of thumb. With 20 eggs, you have about an 80% chance that you will have a baby from those eggs.
Oh,
because in humans, not all eggs can give us a baby.
yeah.
There's a Spanish study that we did. If you are 35, about 1 out of 15 eggs will be a viable egg that can give us a baby.
Okay.
So it's an interesting and important statistic that the older you are, the more eggs we need to freeze. So sometimes a woman will need to freeze in more than one cycle. So not everybody will make 15 to 20 eggs in one cycle.
Okay. What is the approximate cost of egg freezing?
It is roughly about 35,000 Rand. The medicine depends on how much medicine you need. So we really try to keep costs down. And we've decided at Aevitas that the second and third cycle will be for a lower cost.
Wow.
So we really possible for women to do a second and third cycle if they need to.
Wow. Would that be the same going forward with IVF as well? Is that what you guys do?
We've also recently decided, so people who have been patients at our clinic, we want to encourage them if they need another cycle. So we've also decreased the cost for somebody who's been with us before for a second or third cycle.
Okay, so I know I've got one of the ladies that's from Aevitas, I think, that she is a patient there, or she's coming back to be a patient there. She is listening right now. So there you have it. If you are going for a second or third cycle, Aevitas has discounted their rates, ladies. So please get in contact with Aevitas Clinic. Another one is, what happens after you have frozen your eggs?
So we keep it for you. There is a fee per year, and we will explain everything to you. So we keep the eggs for you, and so when you're ready, you let us know, and we plan to when we do the transfer.
Okay. Just one more question. One of the questions is, what about using a sperm donor if the person doesn't manage to find a partner? Can they get a sperm donor with you guys? How does that work? Can they consider a sperm donor?
We've had a sperm bank for many years. So we really high quality. We have a very good campaign that we can really pick and choose sperm donors. Wow. You know, in January we had 100 applicants, many who wanted to donate sperm, and we selected one. We have strict criteria. Wow. So I'm really proud of the quality of donors that we have in our sperm bank.
Wow.
So it's open to anybody, wherever you are in the country. We send the sperm all over the country from people who request it. So it is an important part of what we do.
Yeah. So you're hearing again that people think that you can just go walk into a sperm bank and anyone's donating and you don't know who you're getting or anything like that. So it's nice to hear that you guys are very strict about who it is that can donate. And you get the whole profile of the person when it comes to egg donation. When it comes to sperm donation as well. It's a subject that doesn't get spoken about much. We talk about IVF, we talk about infertility, but we don't actually talk about women that is going through where they need to get sperm donor or they need to actually get egg donor. And they're always worried about who they're going to get or what they're going to get. Yeah. So it's good to know that there are all these measures that's put into place. So you're not just going to get anyone's.
And of course, it's anonymous, so you get all the information that we have, apart from you don't get the name or an adult image. But
okay. By when Okay, somebody, I think we've asked this question already, but by when do I need to use my, no, we didn't. Sorry, by when would I need to use my eggs? What is the, the cutoff time where you say, okay, sorry, you're going to need to get a surrogate now or something like that? What would be a cutoff age?
We like to treat women under the age of 50. So even with donor eggs, or whether it's your own eggs that you froze, if you're healthy enough, our society, SASREG, recommends that we do not treat after the age of 50.
Okay, so what is the, if this is not part of the questions, but what was your oldest woman that you've actually treated when it comes to infertility? What was the age of the oldest woman? I'm sorry, I'm just being very nosy.
Yes.
Because you get these questions all the time, and I always wonder, when do I say to someone, no, I think that is not,
We've had a woman of 53 who came from Australia, and we did all, she was seen by a cardiologist, she was seen by a high-risk obstetrician, so everybody, psychologists, everybody approved, and we wanted in certificates that they all approved that she's healthy enough and mentally healthy enough to go on this journey. And yeah, so she had a baby from us. So that was the oldest that we, yeah. Wow. It's not common. Interesting. Yes. Some women have a career, they have a second relationship.
Yes.
And there you are.
Yeah, I mean, all those little things, it might be a silly question to ask at some point, but it's all these little things that actually bring hope to someone sitting there watching and thinking, oh, I'm 45, I'm too old for this. So, there is still hope. And if you obviously go and see the correct, again, we stress the point of going to see a fertility specialist, going to a local doctor, your general doctor is not going to, when you get to a certain age, it's best to go and see a fertility specialist because they know what they are doing. So I just want to say thank you, doctor. If you want to get hold of doctor, his email address is Victor. Is it Victor.Hulme?
No, just Victor Hulme. Victor Hulme at aevitas.co.za.
Yeah, Victor Hulme at Aevitas.co.za. You can email him. I'm just going to give me 1 second. I want to see if there's any comments on Facebook.
Okay, while you check,
Leanne,
can I just emphasize something? It is just important to emphasize that there are no guarantees in this.
Yeah.
We don't change women's behavior. If you're looking for a partner, then continue on your journey. But this is an option of being your own boss.
Yeah.
And at least know that this option, no guarantee, but there is another way to work with this.
Awesome. Thank you very much, Doctor. Thank you for taking the time out to doing this talk with us. And if any of you ladies want to get a hold of Doctor, he's at Aevitas Clinic, and you can contact them. And also, I don't know if you guys heard that he said if you are doing a second and a third cycle when it comes to IVF, they have discounted their prices. So please get in contact with him. Thank you very much and have a great weekend, Doctor.
Thank you, Leanne.
Pleasure. Thanks. Bye.
Bye.